Hello, everyone, and welcome back to the podcast. Today we have Nurse Skura with us. She's a registered nurse working for Toronto Public Health in COVID response. We're very happy to have her. Welcome to the show, Nurse Skura.
Thank you. I actually work for York Region Public Health, but we're
York
very
Region.
closely related to Toronto Public Health.
That's my bad, my apologies. York Region Public Health.
Yeah.
I guess just to begin, could you begin by describing where exactly you work and how long you've been working there?
Yeah, so I work for York Region Public Health as a COVID response. And it's a year contract. And essentially what we're doing is we're doing like I first started the job, I was doing contact tracing. So what that entailed is I would call any positive COVID patients in York Region, and I would give them isolation dates, and I would contact trace. So if they have any close contacts, if they went to a workplace, I would follow up with all of those areas to ensure that we stop the spread from that positive case. And then I got moved in this role to institutional outbreaks. So what I'm doing currently right now is working for the intake of institutional outbreaks. So if there's like a long-term care home, a congregate setting, a retirement home, they come to us about, oh, we have a positive staff member, a positive resident, and then it comes through our intake, and then we send it to case investigators that follow up during the outbreak.
Awesome. And I think just to provide a little bit more context, could you describe how exactly you became a registered nurse and what first interested you about working in the healthcare industry?
Yeah, so I wanted to be a vet until I was in grade 11 and I did co-op, and I realized being a vet came with seeing a lot of dead animals, and then I also realized I was allergic to cats. So that dream, hopes and dreams fell out the window. So from grade 11 till 12, I kind of was a little bit concerned about my future and I didn't know what I wanted to be. And from grade 11 till 12, my mom got diagnosed with breast cancer. And a year before that, my parents had separated. So she actually was alone in her breast cancer journey. So, because I'm so close to her, I actually became like a natural caregiver to her. So I would go to appointments, chemotherapy appointments with her. I would try to like understand medically what was going on, even though I was in high school. I didn't know too much at the time because I wasn't like in the medical field, but I knew as much as I could. So it was a day off from school that I had. I had like a PA day, and I went to chemotherapy with her. And my mom was like really nervous because she hated the feeling of chemotherapy. It just made her feel really sick. And the nurse came in and completely calmed her nerves. And I right then and there, I literally had university textbooks with me about like where I wanted to go, what I wanted to do. I was thinking environmental studies. And it was right then and there that I knew I wanted to be a nurse, because the impact that one interaction had on my mom through this incredibly difficult process that was not only impacting my mom, but it was impacting our family. And I would love to be that change maker in someone's incredibly difficult journey. So that's when I decided to be a nurse. And I always thought I was going to end up in oncology. But essentially I had been placed in pediatrics in my last year of school. And I had in one semester, and I absolutely loved it. It's very like empathetic, family centered. And then I got placed in my final semester in oncology, and it was just a little bit too close to home for me. Thankfully, my mom is cancer free, but it was just a little bit too close to home. Working in that environment, it was very fast paced, and it was sad. There was a lot of sad things that happened. So I ended up becoming a pediatric nurse, and I was a nurse at bedside for 5 years up until this September, where I ended my bedside career for the time being during the pandemic, because I have really bad asthma and I was petrified working on the front lines. And I had already been taking a leave of absence because I was doing my master's of public health in Indigenous health at U of T. So it was a very easy transition coming out of bedside, because I had pre-pandemic already been away from the bedside for close to a year. So because I was a full-time student. So I do miss the bedside, but I really like my new public health role, and being able to combat this COVID from the sidelines.
Wow, that sounds like a really amazing way to kind of get into your occupation. Could you describe a little bit more? I know you mentioned before that right now you're working a lot with contact tracing and COVID specifically, but in a broad sense, what is it exactly that registered nurses do?
Oh, there's so much that they do. There's so many roles. So if you're looking at like what a bedside nurse does, that could be long-term care, that could be acute care. So that could be like hospitals, that could be retirement homes, that could be community centers. So there's different community centers in the city, especially for sometimes like the homeless population or the indigenous population, or there's diverse cultural nursing. But there's also public health nursing. There's also like I know some nurses that are educators for cannabis when that became legalized. There's nurse practitioners. This is not to cover, like, this is just a minimum coverage of, there's so many more types of nurses. But essentially, what nurses do, like what I could say at the bedside, is they are given so many tasks in a day, so many tasks. So you'll have like, if you're an adult care, you'll have up to like 6 patients, sometimes 7 patients. And you literally have like a list of things that you have to do for the day. So it's like medications, a bath, or, there's physio that you have to assist with. So there's like a list of so many things that you do. But on top of everything, nurses are empathetic, they're loving, they're caring, they wear their heart on their sleeve because it's that profession. And they see and do a lot. And my heart goes out to all of the frontline workers currently during this pandemic, because there's a lot of very traumatic things that they're seeing happening, especially in the ICUs and with the COVID patients, just based off like what my colleagues have told me at Sick Kids, and also what I've been reading on online. So their job is I can't even describe what a nurse does in one session with you, because there's so much. That there's school nurses. I completely forgot to mention that. Anna's an incredible school nurse. There's educational nurses, sexual health nurses, nurses that go up north to indigenous communities, so many different kinds of roles. But essentially every nurse has a heart of gold. There's empathy, huge wide knowledge base, because you got to know so many things in what you're doing. And Yeah, there's RPNs as well, so registered practical nurses, which are essentially the same as RNs, but they go to school for 2 years as opposed to 4 years. But yeah, there's if I had to sum it up in a couple words, what nurses do, I would say that they are compassionate, caring lifesavers.
That's amazing. I wanted to talk a little bit more about kind of your roles specifically. Again, you mentioned that you did some work with contact tracing and more COVID-centered tasks, but obviously that's happened since the pandemic, and that there was kind of a transition there. And you also mentioned that you're working a little bit more remotely now as well. Could you describe how exactly your roles kind of shifted and what changes were made since the pandemic started?
Yeah, so pre-pandemic, I was a full-time student, but before that, before I was doing my master's, I worked at Sick Kids and I was a bedside nurse for respiratory medicine. And in that role, it was incredibly rewarding, but it definitely had its positives and negatives. The job in and of itself, you're dealing with children, right, and their families, and with that comes a lot of unfortunate circumstances that you can see there. But in that role, I personally found that Sick Kids had very supportive colleagues, very supportive management, and it was overall an incredible experience being a nurse there. So then I transitioned, I took a year off of that to do my master's, and then I had the option to go back to Sick Kids in September, but that was the beginning of the pandemic. I guess essentially the second wave in September. Well, the beginning of the second wave in September. Sorry, maybe the first. Yeah, so first or second wave, but
It's definitely hard to keep track. Yeah.
yeah, because this is the third wave, and then there was the wave in December. Yeah. So, anyways, it was quite scary for me because I have asthma, and I was quite scared going back in the front lines, and I also hadn't done it for a year because I was doing school. So I transitioned out of the bedside. I also had done it for 5 years, and I think when I did my master's in public health, I kind of knew I was going to potentially come off of bedside nursing. The shift work and the long nights were pretty hard on the body and the mind and the soul and the spirit. So when it was September, I was working for U of T because I was a student there, and I was doing some research, and essentially I decided to apply to be a public health nurse. I applied for York Region Public Health, and I really like public health. Like, that's why I was doing my master's in public health. And I got the job. So what I started in the role, I was a contact tracer. And what I did in that role is any positive patient in York Region, I would be calling them. I would first check in how they're doing, like how are their symptoms? Are they okay? Are they medically stable? I would encourage them to seek help if needed, like emergency help if symptoms progress. And then I would do a bit of contact tracing. So who have you seen? Have you gone to work? And then it's just stopping the spread of COVID from that one positive case, because it can spread really quickly, as we've noticed. And then I was voluntold that I was moving to institutional outbreaks, and I'm quite happy with the change. So in that role, what we do is we follow long-term care homes, congregate settings, and retirement homes that are in outbreak. And it can either be a suspect outbreak, a surveillance outbreak, or a confirmed outbreak. And we essentially check in with them every day and see if there's any way York Region can support them. And also just stopping the spread within institutions. So I really like institutional teams, but I particularly liked being on intake, which is when new cases come into us for institutions, and we kind of do like a further investigation on it and then decide, like we send it to our doctor and say, or our managers and say, this is what happened. Will this go into outbreak? So I've fully transitioned to an intake role on institutional outbreaks for York Region. And I work remotely. So what that means is I went to York Region for training, and they gave me a computer, a desktop, and I work from home every day. It is a little bit isolating. I definitely miss that rewarding part of like bedside nursing where you see people, you care for people, but I still feel like we are making public health in general is making such a difference in terms of the COVID response. So I feel fortunate to do that.
Yeah, I was actually wondering if you could speak a little bit more about that, because a lot of the experiences you talked about were about when you met with nurses, how there was that kind of personal relationship that they had with their patients. And now you're kind of transitioning to a more remote role, which is probably a little bit more unfamiliar in the kind of role of nursing. Could you describe how exactly you were able to transition into that and how you feel about that now?
Yeah, so it is more remote, but it is a part of a team. So I don't feel completely isolated because we're always checking in with each other. We're on a team. We've got managers, we've got supervisors, we've got like daily check-ins on our team. It's less dealing with like the patients and less dealing with the cases. It's more so dealing with like the managers of the institutions. However, if there is a positive staff case, we do call them and we do check in with them. It definitely feels different because it's a virtual space, right? So you're calling people and you're seeing how they're doing, but you don't truly know how they're doing because there's no body language, there's no face to face. It's just over the phone. So it's definitely a different kind of work. Really important role and really important piece of work public health does. But yeah, however, I do miss that face-to-face interaction that bedside nursing did provide. And public health, does have face-to-face interactions. It's just that sometimes there's roles now that have shifted to remote um, due to COVID, just to protect the workers, right? The public health workers. Um, but essentially, it's been very rewarding in different ways.
Yeah, so this next question I've actually asked previous interviewees as well, and it's about kind of how prepared you felt going into this. And I've had different kind of guests, and some were maybe a little bit newer to the health industry, so they weren't so sure about their kind of responsibilities going into this, and some were more experienced, and they were like, "Yeah, I got this. I was totally prepared." How prepared and well equipped did you feel to confront the kind of different environment that you were entering with this pandemic?
I actually felt very comfortable in the challenge, the new challenge of being a public health nurse. I've never been a public health nurse before. I also wasn't super familiar with contact tracing. Like I wasn't, before I got the job, I wasn't like knowing every single directive that exists in Ontario that, I was just living life. So when I started the role, there was a lot of information I needed to learn, like the isolation period, the period of communicability, like all of these new terms and new roles that I had to kind of navigate in this new role. But I never found it overwhelming. I mean, mind you, I was still a student at the time completing my master's. So I was full time and part-time / full-time student at the same time. So I would say that I was overwhelmed in my lack of time and energy that I had. However, the role itself was so accommodating. Like York Region Public Health was so accommodating that if I needed extra time to like learn, or if I needed extra time to understand concepts, they were very willing to provide that. And they provided like extensive training for all the new nurses. It was like 2 weeks, you're like reading all the stuff. And then within those 2 weeks, you're like shadowing some nurses. If you need extra shadow time, they're very open to that. So I found the whole environment, though it was challenging, very supportive and not too scary.
I actually find that pretty interesting that you felt that this shift to kind of a completely different type of nursing was a smooth transition. Do you actually envision these types of changes in healthcare holding true into the future? What type of changes do you see in the healthcare industry after the pandemic?
So, I mean, there's all different kinds of healthcare, right? Like there's public healthcare, and then there's the acute hospital care. Like there's all these different aspects of healthcare. I think public health is very adaptable and very able to grow from certain experiences. So I think they were already like from when I started, like very well adapted to COVID and very well adapted to like training new nurses. I haven't heard any bad things about like the training process. I found like everyone else felt like it was very smooth as well and very well supported. However, for the hospitals, I hope that there is a lot more that is learned from this in terms of like, you know, more of a systems level, more of a system, because right now they're not super supported healthcare workers. Those lack of paid sick days and the lack of support from the government that they can face, it does strain a lot on the healthcare system. So there's like less nurses working. There's a shortage of nurses. They're having nurses like work too hard every shift because they're short staffed, right? So it's like all these nurses have X amount of patients because all these staff didn't show up today. So I hope that through the pandemic response, we do look at our hospital system, like our specifically hospital. And I would love to see more diverse care, right? More diversity inclusion when it comes to like the healthcare system. That's why I did my master's, because I'm Métis, so I like my dad's Métis, so I'm Indigenous, but I don't look Indigenous, and it was because of the way that I look. I had kind of witnessed some unsafe behavior towards Indigenous patients, probably because they didn't assume that I was Indigenous. And so I went to do my master's because I really was hoping to create more of a diverse, safer space for specifically Indigenous patients. But I would say that a lot of patients need to also feel safe, for all the diverse patients. Our medical system is very Western, which is okay, but I think they need to open the doors to more of a diverse kind of diverse healthcare system. So I don't know if the COVID response will lead to that, but I think that hopefully it leads to a little bit more of an understanding of how things can be better, especially with long-term care homes. Like, we've noticed a lot of discrepancies in them through this COVID response, unfair treatment of like PSWs. They're always hired as part-time or casual, never full-time, and they're kind of worked way too hard in a lot of ways. So I'm hoping that out of this pandemic, it highlights the discrepancies that the government has let down in healthcare, and hasn't paid enough attention to. So I'm hoping that that will be a change that comes out of this.
I was wondering, because you did bring up that there were these kind of different discrepancies in different areas of healthcare. Um, I guess if you don't mind, and if you are able to, kind of speak to the experiences of people working in different industries. Maybe you yourself, certainly working remotely, might have its own share of different challenges. What exactly are the mental, the physical, the kind of social ramifications of working as a healthcare worker in this pandemic?
Yeah, so for me, I definitely count my blessings, but it is very isolating. Working remotely is great. You have a supportive people online. Your team works with you. I feel like they're my family from York Region Public Health. However, it is quite isolating. Like, I don't go to work every day and see people. I go to work from my bedroom, and I walk down to my kitchen, and there I am, just by myself. So I find the challenge can be very isolating. However, I'm so grateful for this opportunity to be at home and to be safe, because a lot of people don't have that privilege. A lot of people do have to go to work every day, and risk their lives getting COVID, and risk going into work, potentially getting it. So I think the challenge for the frontline workers is balancing, you know, their holistic being through such a difficult time. Like, they probably can't see their loved ones because they have exposures at work, and they probably are feeling very lonely and isolated. And I'm sure that my heart, like I said, goes out to all my frontline worker nurses and doctors, and all healthcare workers for that matter, because they're seeing a lot of things that we would not have seen pre-pandemic, like ICU beds full, incubating like 7 patients in one night, like code blue every single night, code pink. Like, it's just, I think there is going to be a lot of PTSD that comes out of the frontline workers in this experience. And I really, really, really pray and hope that they're acknowledged for that, and they're supported through that, because as we've seen so far, the government hasn't been super supportive for nurses in a lot of ways. But what they're doing is beyond what anyone can imagine, right? And they didn't sign up to that to be a nurse. They didn't sign up. I mean, they signed up to face some challenges, but not like challenge after challenge after challenge after challenge, because now we're in our 3rd wave, and it's the worst it's ever been. And I'm sure that they are just exhausted and would just like to have some peace eventually, right? So I think there's pros and cons to virtual working as well as frontline working as a nurse, but I would say I definitely count my blessings working virtually, because there are a lot of risks being frontline right now.
And just as a final question, Nurse Skura, and I like to remind my guests, you are speaking to largely a high school audience. Are
Yeah.
there any parting words you'd like to offer about what it's like to work as a healthcare professional, perhaps not directly on the front line or in the unique role that you're in, especially during a pandemic of the scale we're experiencing now?
Yeah. So the youth are the future. I would say getting into the healthcare profession, you definitely have to be passionate about it. It's a lot of hard work. It's a lot of empathy. It's a lot of care. But I don't doubt that people don't have that within them. And if anyone is listening and they're in high school and they hope to be a nurse or they hope to be a doctor, or they hope to be a physiotherapist or any other healthcare profession for that matter, I would say go for it, strive for your dreams. It wasn't easy getting into nursing school for me. It was definitely a challenge. And being in nursing school also came with challenges. But I would say that keep pushing through, because if you're passionate and you have the heart and you have the interest and the compassion, then it will all work out. And you're all the future of our healthcare system. And I'm excited to see new emerging youth into the healthcare system, because it's going to be your time to shine, and I'm sure you're all going to do amazing. And also, don't look at like gendered roles, like they always say, like, in movies, it's always like a doctor is a male and a nurse is a female. I know a lot of amazing male nurses, and they're incredible. So I would love to see more male nurses. And I would love to see more female doctors. But unfortunately, the roles have been gendered in our society, but don't listen to that, because being in any of those roles is incredible if you're able to be that. So, and if you're interested in being that.
Nurse Skura, I really appreciate your time. Thank you for joining us today.
Of course. Thanks so much, Albert.
Thank you for tuning in to this episode of the Stories from the Frontline podcast series. Nurse Skura has certainly been a very insightful guest, and her story was nothing short of awe-inspiring. I personally certainly understand much more about the realm of nursing under the pandemic and the special role that these individuals hold in hospitals and with their patients. I hope you were able to learn something from Nurse Skura as well. Until next time, stay safe and stay curious.